Good day everyone, I am Eliza Steli Pilapil together with my groupmates Mercedes Lavilla, Samantha May Sagales, Ken Clary Shane Antolin, and Sean Brillantes. Today we will talk about assessment for violence. But first, let us define violence. So according to the World Health Organization, violence is defined as the intentional use of physical power or threaten or actual against oneself, another person, or against a group of community that either results in or has a high likelihood to result in injury, death, psychological harm, and maldevelopment of deprivation. So, why do we assess for violence? So, we assess for violence to identify situations wherein an individual is more likely to become violent and situations where their risk of violence might be lower. This is also to provide for staff and patient safety. So, we have 4 types of violence, such as physical abuse, psychological abuse, economic abuse, and sexual abuse. So, let us talk about physical abuse first. Physical abuse refers to any intentional act of causing physical harm or injury to an individual. It can involve hitting, punching, kicking, slapping, choking, or any other form of physical assault. Physical abuse often leaves visible bruises or injuries on the victim's body. Next is psychological abuse. Psychological abuse, also known as emotional abuse. Next is psychological abuse. Psychological abuse, also known as emotional abuse, involves the use of verbal or nonverbal tactics to manipulate, control, intimidate, or degrade an individual. It can include constant criticism, humiliation, threats, isolation, intimidation, and manipulation. Psychological abuse aims to undermine the victim's self-esteem, sense of worth, and emotional well-being. Next is economic abuse. Economic abuse refers to the control or exploitation of an individual's financial resources by another individual. This can involve restricting access to money, preventing the victim from working or accessing education, controlling finances, stealing money, or exploiting financial resources for personal gain. Economic abuse can lead to financial dependence and limit the victim's ability to escape the abusive situation. Lastly is sexual abuse. Sexual abuse involves any non-consensual sexual act or behavior imposed on an individual. It includes unwanted sexual contact, rape, forced sexual acts, and inappropriate touching. Sexual abuse is a violence of the victim's body's autonomy and can cause severe emotional and physical trauma. For the prevalence of violence, for women, 100,000 days of hospitalization, there are 30,000 emergency department visits and 40,000 primary care visits per year. And for men, 1 out of every 7 men experience physical violence. So that just says that more women experiences violence more than men.
Hi, I'm Samantha May Sagales from BSN 1B. So I am here to tackle about the theories of domestic violence. So number 1 is psychopathology. This theory suggests that domestic violence is caused by mental illness or personality disorders in the perpetrator. Built by stress and coping theories like domestic abuse may be viewed as maladaptive coping mechanism for managing stressors such as financial difficulties, relationship conflicts, or feelings of inadequacy. So additionally, we have attachment theory, trauma theory, personality disorder, cycle of violence, and cognitive behavioral theory. It is important to recognize that domestic abuse is a complex phenomenon. Interventions often require a multi-phase approach. Next up we have is social learning. So originating from behaviorism, this theory posits that individuals learn behaviors by observing and imitating others. In the context of domestic violence, individuals may learn violence behaviors from their family members, peers, or media representations. Additionally, it can also build by reinforcement, modeling, normalization. So understanding the role of social learning in domestic violence, can inform prevention and intervention efforts by addressing the underlying social and cultural factors that contribute to the perpetration of violence behavior. So, by promoting positive models of conflict resolution, challenging harmful gender norms, and providing education on healthy relationships, it's possible to disrupt the cycle of violence and promote nonviolence alternatives. Next that we have is biological. So on this, it examines the role of biological factors, including your genetics, your neurobiology, and your hormones. So biological factors interact with social, psychological, and environmental influences to shape individuals' prosperity for violence. Effective prevention and intervention effort must address the multi-phase nature of domestic violence, taking into account biological, psychological, and sociocultural factors. Next is family system. So this theory views domestic violence as a result of dysfunctional interactions and communication patterns within a family, such as lack of communication, lack of boundaries, and unresolved conflicts. For example, in families where communication is hindered or where conflicts are not addressed constructively, tension may escalate to violence as individuals struggle to express their needs and resolve disputes. Lastly, we have is feminists. So these theories of domestic violence focus on power dynamics, gender inequality, and patriarchy as central factors of contributing to the occurrence and perpetuation of violence against women within intimate relationships. So, for example, the examination of the power and control dynamics within abusive relationships. So, in a feminist analysis, domestic abuse or domestic violence is not simply viewed as a result of individual pathology or relationship conflicts, but it views rather a manifestation of broader societal structures and perpetuate gender inequality and uphold patriarchal norms.
To effectively identify and address cases of violence, here's how to conduct a thorough nursing assessment. Before approaching the patient, you must prepare yourself for the examination. This means to mentally prepare yourself to handle sensitive information and situations. Also ensure that you establish a safe environment for both you and your patient. Next, collect subjective data by using interview techniques such as non-directive and directive interview approaches. By using a non-directive interview approach, you're asking open-ended questions and letting the client tell their side of the story. By using a directive interview approach, you're asking closed-ended questions to gather specific information and guide the interview in a specific direction. Lastly, we can collect objective data by performing a physical assessment. This involves examining the patient for signs of psychological trauma, physical trauma, or injury. We can begin the physical assessment with a general survey by observing the patient's general appearance, behavior, and hygiene. It's important to pay attention for any signs of distress or discomfort. Assess the patient's mental status, such as their cognitive function, mood, and behavior. Look for signs of anxiety, depression, or confusion that may indicate psychological trauma. Evaluate the patient's vital signs. This includes blood pressure, pulse rate, respiratory rate, and temperature. Changes in vital signs may indicate stress or physical trauma. Inspect the patient's skin for any bruises, burns, cuts, or injuries. It's important to note the location, size, and color of the injury as well. Inspect the patient's head and neck for signs of trauma such as bruising, swelling, or open wounds. Inspect the patient's eyes for any redness, swelling, or bruising around the eyes, as well as assess the patient's vision and pupil response. Inspect the patient's ears for any bruising, swelling, or open wounds, and assess their hearing if necessary. Assess the patient's abdomen by palpating it for areas of tenderness. Look for any signs of internal injuries or trauma. Gently assess the patient's genitalia and rectal area for signs of trauma or abuse. Assess the patient's musculoskeletal system by documenting their strength, range of motion, and any signs of musculoskeletal injuries, such as fractures or dislocations. And lastly, assess the patient's neurological system by evaluating their sensations, reflexes, and coordination. Pay attention for any signs of head trauma or neurological deficits.
I will discuss on how to validate and document findings in assessing patient. By addressing this aspect comprehensively, nurses can enhance their ability to provide holistic care, support patient, and mitigate the risk of harm. So first is health promotion diagnosis. Ensure that the assessment includes questionnaires related to mental health, coping mechanism, and stress management. Validate findings by comparing them with established health promotion guidelines and evidence-based practice. So document positive health behaviors and areas of improvement to promote overall well-being and to prevent potential self-harm or violence. For example, during a nursing assessment, a patient reports feeling overwhelmed with stress due to work and family responsibilities. They mention difficulty sleeping and frequent headaches. The nurses validate these findings by discussing healthy coping strategies such as exercise, relaxation, and seeking social support. Document the patient's stressor, coping mechanism, and education provided on stress management techniques to promote overall well-being and prevent potential self-harm. So next is actual diagnosis. Assess for signs and symptoms of mental health disorders such as depression, anxiety, bipolar disorder, or post-traumatic stress disorder or PTSD. Validate findings by conducting standardized assessments such as patient health questionnaire for depression or the generalized anxiety disorder 7-item scale for anxiety. Document observable behaviors of patients, such as their statement and clinical observation, to support the actual diagnosis. For example, a patient presents with symptoms of low mood, loss of interest in activities, and feeling of hopelessness. They express thought of self-harm and have a history of depression. The nurse validate these findings by administering the PHQ-9 and observing the patient's affect and behavior during the assessment. Document the patient's score on the PHQ observable behaviors indicating depression and the patient's self-reported suicidal thoughts support the diagnosis or major depressive disorder and assess the risk of self-harm. So next is the collaborative problems. Collaborative problems involves issues that require intervention from multiple healthcare providers. Validate findings by consulting with other members of the healthcare team, such as psychiatric, psychologist, social worker, or counselor. Document collaborative interventions and ongoing communication among healthcare team members to address potential violence or self-harm. For example, a patient with a history of substance use disorder presents to the emergency department after a suicide attempt. The patient requires coordination of care between the emergency department staff, psychiatric team, and social service for ongoing management. The nurse validates these findings by collaborating with other healthcare providers to develop a comprehensive treatment and a plan addressing both the acute medical needs and the underlying psychiatric issue. So document the involvement of the interdisciplinary team, communication among team members, and the plan for follow-up care to address the patient complex need and to reduce the risk of future self-harm. So next is the medical problem. Assess for any medical conditions that may contribute to psychiatric symptoms such as substance use disorder, traumatic brain injury, or chronic pain. Validate findings by reviewing medical records, laboratory results, and diagnostic imaging studies. So document medical results and their impact on mental health management and risk of violence. So for situational example, a patient with chronic back pain presents to the clinic with the symptoms of depression and increased irritability. The patient pain management regimen includes opioid medication. So the nurse validates these findings by reviewing the patient medical records, current medication, and any changes in pain intensity or function. So document the patient history and provide the appropriate care that the patient needs to help them ease their problems. So next is the risk diagnosis. Evaluate the patient risk factor for violence or self-harm, including past history, current stressor, access to means, and social support. Validate findings using standardized risk assessment tools such as the CSSRS or the Columbia Suicide Severity Rating Scale or the Manchester Self-Harm Rule. So document the identified risk factor, protective factors, and the development of a safety plan to mitigate the risk of violence or self-harm. For instance, a teenager presents to the pediatric clinic with a history of self-harm behavior, including cutting and recent conflicts with peers at school. The patient reports feeling isolated and hopeless about the future. So the nurse validates this finding by administering comprehensive risk assessment, including the CSSRS, and assessing the patient access to means for self-harm. Document the patient risk for self-harm's protective factors such as family support and the development of a safety plan including coping mechanism, emergency contacts, and referral to mental health service and other factors that she may need so that self-harm can be prevented.
So in assessing a safety plan, it involves several crucial steps to ensure the client's well-being in abusive situations. So here are some key components to consider. So first is you're going to ask the client. So first question is, have you packed a bag ready? Keep it hidden but make it easy to grab quickly. So sabi dito, ensure the client has a bag packed and hidden. So hindi naman kailangan na tagong-tago. Mas okay yung safe pero in case of emergency, makukuha at mahanap natin siya ng mabilisan. So yung bag na yun, kailangan it contains essentials such as clothes, documents, medications, and any valuables. It should be easily accessible in case of emergency. So kailangan na hindi pwedeng bag lang, tas ang dala lang makeups, not necessarily need naman. So kailangan yung bag yun is naglalaman ng such as clothes, documents, medications, and any valuables. So pwede rin pera, cash, kasi okay din yun in case of emergency. So next is tell your neighbors about your abuse and ask them to call the police when they hear a disturbance. So you're going to inform your neighbors, no? Encourage the client to inform trusted neighbors about the abuse they experiencing. So kapag kayo na yung nakakaranas ng ganito, mas maigi na i-inform yung any neighbors, relatives, close friends, para at least aware din sila na gano'n na pala yung nangyayari sa inyo. Meron na palang abusive na nagdaganap. So they should request their neighbors to call the police if they hear any disturbance or signs of violence. So kung sino man yung nilapitan or tinawagan nyo na neighbor. So, if yung relatives na yun is nakakarinig ng any disturbance or parang nakakatunog na siya, may hint na siya na meron ng any violence na nangyayari sa inyo, so mas maigi na tumawag na ng police. So, next is you're going to have a code word used with your kids, family, and friends. So, sabi dito, you're going to establish a code word, have a code word established with the clients, children, family members, and close friends. So yung code na yun is makakatulong sa inyo para magkaroon ng signal danger or nag-indicate siya ng immediate assistance. So magkakaroon kayo ng word code para at least kahit pa paano kung sino man yung suspect or gumagawa ng any violence sa inyo, hindi siya makakatunog, hindi niya alam na humingi na kayo ng tulong or hindi niya alam na ganun na pala kasi nga may word code na ginawa sa inyo, hindi aware. Yung word code na yun is dapat umiikot lang sa relative, friends, close friends na pwede niyong malapitan. So dapat confident kayo lang para at least kung sino man yung gumagawa ng any violence sa inyo or any abuse, hindi sila aware. Dapat sa inyo lang, confident lang yung word code na gagawin. So, next is, know where you are going if ever you have to leave. So, you're going to inform your family and friends. So, mas okay na it's important for the client to let trusted individuals know about their situation and where they plan to go if they need to leave suddenly. So, mas okay na i-inform nyo yung relatives, friends, kung may kailangan man kayong puntahan na saglit lang, kailangan talaga. Pero kung hindi naman ganun ka-importante o kahalaga, huwag na kayong umalis. Pero kung mahalaga naman or kailangan talaga, mas okay na i-inform nyo yung inyong relatives or any friends para at least aware sila na wala kayo doon, na aalis kayo, hindi sila mag-worry na if ever na pupuntahan ka nila tas wala ka doon, at least aware sila, hindi sila mag-worry. So, lastly is you're going to remove weapons from the house. So, remove weapons. Advise the client to remove any weapons or objects that could be used as weapons from the house to prevent escalations of violence during conflict. So, yung mga pwedeng makadisgrasya gaya ng mga patalim, kutsilyo, or kahit anumang matatalim na bagay na pwedeng maka-harm or maka-cause ng accident or nakakapatay gaya ng kutsilyo, mga ganun. So, mas maigi na tanggalin or itago, isantabi muna para at least hindi siya makakakos ng any accident during conflicts. Mas safe, mas okay yung ganun para if ever na may conflict, hindi magagamit yung sandata or yung patalim na yun sa inyo or kahit kanino man. At least kahit pa paano, maiiwasan natin yung any for us in danger, mas maiiwasan yun. So, hindi lang basta-basta yung mga binanggit na step na yun is parang wala lang. So, each step plays a crucial role in ensuring the client's safety and preparedness na din to live on abusive situations if necessary. Violence during conflicts. So, next is, in assessing a safety plan, you have to gather the following. So, first is cash, social security cards for you and your birth certificate. So, in ensuring, so first is the cash. So, in ensuring you have a sufficient amount of cash or hand to cover immediate expenses in case of an emergency. So, kailangan is meron kang kahit onti lang, at least meron, kahit any amount will do, such as for example is 500 pesos. So, in case of emergency, meron kang dudukutin. So, next is driver's license, rent, and utility receipts, bank account numbers. So, social security cards for you and your birth certificates naman, as mentioned kanina, these documents are essentials for identification purposes and may be required for assessing certain services or benefits. So, mahalaga yon if ever na kailangan niyo ng documents, kunwari sa isang family member or sa isang social group, kailangan ng isang member na kailangan na nagpapatunay na ito siya, ganun. Kailangan ng identity. So, mahalaga yung birth certificate or any valid ID sa ganung sitwasyon. So, sa driver license naman, your driver license serve as primary identification, gaya ng birth certificate. Sabi ko nga kasi valid ID yan. So, next is insurance policies and numbers. So, in insurance family and numbers, keep copies of insurance families for health, home, auto, etc. along with the corresponding policy numbers. This ensures you can quickly file claims or access coverage in case of accidents or emergency. So, in insurance policy and numbers naman, yung kopya ng kunwari insurance, SSSID for example, mas okay siguro kung palagi kayong may kopya na dala-dala or at least kahit pa paano is meron kayong patunay or merong nagpo-prove nga na sa inyo yun or kayo yun in case of any accidents or emergency. So, mahalaga talaga na meron tayo kahit pa paano na may mga ganong documents, no? So, lastly is important of phone number. So, compile a list of important contact numbers such as family members, friends, doctors, locals, organization. So, this will enable you to reach out for assistance or information when needed. So, mahalaga na meron tayong mga contact information such as family, friends, relatives, and doctors, locals, organizations. So, in case of emergency, may ma-reach out tayo, no? May makokontakt tayo, may matatawagan tayo kung kinakailangan para kahit pa paano makahingi tayo ng tulong if ever na may emergency or any accidents. Thank you.